Hey, what's up, everyone? Dr. Lee Thomas here. Good morning, good evening, wherever you're listening in. This is our Rise and Shine workshop. So, this is a workshop that's completely dedicated towards helping you understand the underlying reasons why you might not be sleeping well and going through the secrets and steps that I use and I teach my patients to really work on optimizing our sleep. And so, as we get started with this workshop, I'm sure that either you or someone you know is not sleeping well, and this is really the crash course that's going to help you with that. So I encourage you to take great notes, use our office for more information after this so we can do follow-ups. And then if you know anyone who's struggling with their sleep, please like and share that with them, and follow us for more helpful workshops like this. So what is our mission in our office? We work to help heal people from the inside out. And when we're talking about, a sleep workshop specifically, I'll give you guys a little secret. Whenever I'm coaching people, whenever I'm working on figuring out what's underlying someone's inability to heal or function well, sleep is not number 2 or 3 or 4 on the list. Truly, helping someone sleep better is absolute uno, number 1, okay? Sleep helps bring balance to your body, brings you back to homeostasis, helps you thrive in your health. If you don't sleep well, it's impossible to do really anything else in your life. And so what you're going to learn this morning and today is what sleep is, why we sleep, what causes sleep problems, and we'll go through all those tips and strategies so that you can regain amazing sleep. I don't think it comes as a surprise to you guys watching this that sleep is a big problem, not only in the US, but for humans in general. We're the only species that willingly forgoes sleep. Every other species, they sleep when they need to sleep. But for some reason, we think that burning the midnight oil, staying up later is, somehow helping us, that we can deprive ourselves from sleep and not pay the ramifications of it. But it's a big issue. As many as 50 to 70 million Americans have sleep disorders. That's 20% of the population roughly. And so it's not just about feeling tired. Sleep is when your body heals. So this sleep deficiency issue that a lot of us are having, it's a problem. Lack of sleep has been linked with a lot of different major disease processes in the body. So it weakens your immune system, which can increase the risk of certain cancers, increases the risk of developing Alzheimer's disease because your brain doesn't heal like it should. We'll go through some more research on that in just a minute. It can disrupt the blood sugar levels in your body. So this can actually help push you down the hill of prediabetes and diabetes. So that's even with moderate reductions in your sleep that can happen. It can increase the likelihood of coronary arteries becoming blocked and brittle, increased risk of stroke and congestive heart failure. And we know that it contributes to all major psychiatric conditions. So depression, anxiety, there's a lot of different issues that this can cause. And so there's a lot of warning signs, luckily, in your body that you need better sleep. And one of the things you really want to think about is how to listen to your body. Oftentimes, if we're sleep deprived, if we're not getting the sleep we want, your body's giving you these warning signs. And sometimes we just can't figure them out, but sometimes we're knowingly suppressing these things. So if you find that you're, irritable or moody, that you're unable to focus, if you feel like your blood pressure is increasing or going up, if you find warning signs that your immune system is off, that you're getting frequent coughs or colds, if you're finding yourself one day a week that you're sleeping 12 to 16 hours, some of my friends do this. They're like, oh yeah, I woke up on the weekend and I just had to sleep in until 2 p.m. or something like that, or 11 a.m. when I went to bed at 9 p.m. the night before. Those are warning signs that your body's trying to drastically catch up on sleep. If your blood sugar is out of control, if you seem like you're gaining weight, having weight loss resistance, if you're addicted to caffeine, these are all warning signs that your body is in a sleep deficient state and that you need better sleep. A new study is showing that lack of sleep isn't just causing problems with your body, it can cause problems with your brain. Cognitive problems now are largely being linked to sleep disturbances and a chronic lack of sleep. We know, number one, that as we age, sleeping well becomes more and more difficult. My thought process on that is that we develop more problems in our body that affect our gut, that affect our neurotransmitters. We have stress that accumulates as well. And all of those problems sort of surmount as we age, and it becomes harder and harder to sleep as those stress spots increase. Well, there's a new study showing that chronic sleep deprivation can cause overactivity in the brain's sort of self-cleaning system. And this can lead to the destruction of not only damaged brain cells, which happen when we sleep, our body kills off bad cells. That's part of our body's self-cleaning and healing process. But what scientists are showing is that you can upregulate the activity of certain astrocytes and glial cells in the brain, and that they can start to, if you're sleep deprived, not only kill the bad cells, but also kill the healthy brain cells. In fact, a study came out in 2018 that showed that as much as 13% of our brain loss can be attributed to problems from sleep. So this can lead to an increase in risk of cognitive related disorders, memory loss, Alzheimer's, Parkinson's, and getting sleep is vital. And there's all these new studies popping up that show that it's a big deal. So we have this metabolic waste clearance that happens when we sleep. When we are awake, we have this large increase in norepinephrine inside of our body that helps us stay awake. And then as we become sleepy and restful and want to go to bed, our body takes in more cerebrospinal fluid. It helps pull waste out of our body. We get this downregulation in norepinephrine or in adrenaline, and this is what helps our body calm down and sleep. And so this waste clearance has to happen in order for our brain to heal itself. So how many hours should you be looking to sleep? And these are general rules. We're all a little bit different, but as a general trend, as you go from being a newborn with a high amount of needed sleep, again, newborns can sleep, 14, 15, 16 hours a day. Through infants, toddler, adolescence, your need for sleep does start to drop. Kids still need 9 to 12 hours of sleep per night. So a kid going to bed at midnight and waking up at 7 a.m. for school, that is not enough rest. So if kids are staying up too late, it can definitely cause problems, especially with how early we have to get up to start the morning for a lot of us. So even as an adult, we still need minimum 7 hours of sleep per night. And that can even increase some as we age and become seniors. So again, there's never a time when it's okay to get away with sleeping 4, 5, 6 hours a night and doing that on end. It can cause a lot of different problems through there. There's different stages of sleep as well. You have light sleep in the beginning where, you're relaxed, you're drowsy, very, easy to awake. You have deep sleep. This is when your core temperature drops, your heart rate goes down, your respiration rates go down, body's truly in this deep healing state. And then you have REM sleep, or rapid eye movement sleep. This is what helps you dream, and this is one of the things that helps with your emotional well-being. People who are deficient in REM sleep can have higher rates of depression. And this is when your nervous system starts healing and reintegrating connections during this time. So all the stages of sleep are vital, and there are sleep trackers that are available now if you ever want to get more in-depth information on your sleep habits and wake habits. There are wearables now, Whoop and the rings that you can wear that give you great information on sleep. I, for a period of time, wore those because I wanted to get more information on it. And really after about a month's time, you start to really understand your body. I think it only takes maybe 3 to 4 weeks to really get a good understanding of where the problems are coming from. I did it a few years ago, and it was glaring that if I stayed up too late, if I didn't have a dark enough room, if I was, consuming too much caffeine, if I consumed too much alcohol, you could see these things pop up really easily. And so a lot of the things that we do that, deteriorate our health from a sleep aspect are messing with our circadian rhythm cycles. Our body is, largely speaking, wired for this 24-hour clock that resides deep inside of our brain. And so there's all these different things that are happening inside of our body without us really even understanding or knowing about it that creates this 24-hour sleep-wake cycle. So our eating times, our mood, our body temperature, our metabolic rate, release of certain hormones inside of our body, these are all happening without us really understanding or knowing about how it works. But these are the things that control our sleep-wake cycles. And so as an example, melatonin, it increases as we get to the evening. We get this natural upswing in melatonin. They peak in the middle of the night. And then when we're rested in the morning, they fall down to really low levels to allow our body to wake up. The opposite way of melatonin, we have serotonin. We have these opposite neurotransmitters that help us to feel awake and to feel energized. And so what activates these energizing hormones is light exposure. So if you think about it, in the morning, our body is really built and hardwired to have good exposure to natural light. And so if you're up in the morning, if you're near a window, if you're outside, if you're getting this natural light, that starts this 16-hour clock for you to start this wake sleep cycle. A lot of us unfortunately don't get to wake up and go outside first thing in the morning. Maybe some of us are waking up and getting into an office building before it's even light outside, especially during the winter months. Maybe we're getting ready inside in a bathroom that's inside that has no exposure to natural light. And so for a lot of us, we're not getting this initial trigger to start this 16-hour cascade of serotonin production. And we sort of wonder why we have all these problems. And I think a big issue is a lot of us don't look to fix this underlying issue. We look to maybe take medication, or we look to mask it with caffeine or some type of other substances. The reality is that your body has this naturally built mechanism for regulating sleep-wake cycles. And the more we get our body attuned with what naturally we're supposed to do, with what's been scientifically proven that our bodies are built to do to get good, healthy sleep-wake cycles in play, it's going to be really difficult to regulate these with anything else. So on the counter side of that, what is the antagonist to serotonin? What helps your body build melatonin? There's a chemical in your brain called adenosine. And this is what builds up in your brain. And this is what it's largely believed that actually causes our desire to sleep. At the end of the day, this is what causes us to want to sleep. So for a lot of us, we take caffeine through the day, and caffeine works as an adenosine antagonist or an adenosine receptor antagonist. Basically put, adenosine latches onto sites in your brain to tell you you're tired. Caffeine blocks these receptor sites. So the idea that caffeine gives you energy is not entirely true. Caffeine blocks your brain from thinking that it's tired. So there's a big difference there, I think, to understand that you're not actually gaining energy. You're just stopping your body from feeling tired. When I learned that, maybe 5 or 10 years ago, that it really made me question whether or not I wanted to be someone who used a lot of caffeine. I probably use less caffeine than most people. I might use caffeine on the weekend, almost like as a treat. I want to feel a little bit extra energy on a Saturday, but it's not something I regularly rely on because there's a big understanding in there that caffeine becomes a very addictive chemical, the number one mostly used and even abused psychoactive stimulant in the world. And the more we become reliant on that, the more that we can sort of mask the other problems that happen with our sleep. People use caffeine to make up for bad sleep. And part of the healthcare that we give at Be Aligned Health is cause-based healthcare. And so if you find yourself being addicted to caffeine, well, there's likely an underlying issue going on there that needs to be addressed. Okay, so you can only borrow from Peter to pay Paul for so long. If you have these underlying sleep issues or problems, don't mask it with anything, caffeine or any other type of thing that you have. Fix the cause of it. Because if you keep masking the symptoms of it, which is like the sleepiness, the tiredness, all of those things, you're going to end up developing more issues. So that's the reason I don't love caffeine, is because we can sort of mask sleep problems for a long time until we get into really bad shape, and then it's a lot harder to work on correcting those things. So cortisol. A lot of times cortisol gets this bad reputation. It's commonly known as the stress hormone. So it's produced by the adrenal glands when we're under a perceived threat. So if we're in a fight or flight state, we're going to increase our cortisol production. But really, cortisol is not necessarily just a bad thing. Cortisol is what raises in the morning that actually helps trigger this whole sleep-wake cycle through there. So the reality is that our body needs cortisol. It creates cortisol, but it should flow in a normal, regulated cycle. So cortisol should increase in the morning. As we wake up, it should slowly decrease as we go throughout the day. And then when we go to bed at night, we should see a good drop in cortisol levels. That would be a healthy and fit adrenal pattern of cortisol production. And for a lot of our patients, if you have sleep issues or problems, sometimes we'll actually run a cortisol study, we'll run a neurotransmitter study and look at levels of cortisol throughout the day. And you can see commonly that if there are patterns in cortisol disruption, it closely links with sleep problems and disorders. People who are adrenally fatigued will see an issue with their cortisol where when they wake up in the morning, they don't get a spike in cortisol. They don't get that increase in cortisol, and it kind of slowly raises throughout the day. The issue with that is when it's bedtime, your cortisol levels are still high, and it might take you hours to fall asleep. So you might wake up a few hours after falling asleep. You might feel wide awake. You're worried in the evenings. You're rehashing mistakes. You're stressing about, work or life. You're distracting yourself. So you're spending tons of time like watching TV in the evening. You feel like you're wound up, like you have to quote unquote wind yourself down. That's a big warning sign of low sleep pressure. And a lot of times this could be from cortisol or sympathetic nervous system overdrive. So all common problems. We're going to go through solutions here in a minute. The last part of this is having an extreme adrenal fatigue. So if you are stressed out for a long time and you still can't get away from the stress, eventually your cortisol with lack of sleep over a long period of time, your body stops making as much cortisol. And so this is someone who's in an adrenal exhaustion state. You wake up, you have low cortisol. It doesn't really raise a lot throughout the day. When you go to bed, it's still low. So you sleep well at night. So you think, well, man, I'm sleeping well. I don't know what my issues are. I'm getting to bed. But the next morning, again, the same thing. You wake up with low cortisol. So this is someone who's like tired throughout the day, sleeps a lot, is still tired. This is where you're in, what we call extreme adrenal fatigue or adrenal exhaustion. A lot of times by this point, your blood pressure's up, your cholesterol's up. You're really far from health. You have elevated inflammation markers in your body. You have decreased blood flow to your gut. Your gut's not producing the neurotransmitters like serotonin and dopamine like it should. This is where you're really at a disease state. And a lot of times in here, it takes a lot of work to work on getting it healthier. In our office, this is what we work on, coaching you guys through, helping you guys get to the root cause of these things, get a deeper understanding for where, the train went off the tracks, and having those action steps for getting your body back to a good balanced state when it comes to your health. So napping, just to cover it, I'm a fan of napping. It can improve your learning, alertness, your memory, concentration. Different people respond better to napping. So this is not like a one size fits all, like everyone should nap. Some people do better with napping, some people do not. I personally nap a few days a week, days when I have longer, more exhaustive days. Mondays and Wednesdays, I do about a 13-hour shift. So I take a 20, 30-minute nap in the middle of the day there. But one of the things you have to understand is that napping should not be used to regain sleep loss from the night before. So I would caution you to not get in a habit of napping during the day because you know that you're going to, hey, I only need 5 hours of sleep tonight because I'm going to nap tomorrow. That'd be a bad thing. Napping is meant to kind of get ahead of a busy day or a busy shift at work or life, but you really don't want to try to use it to regain the deep sleep. In fact, we're showing now that it's impossible to catch up on sleep lost. So while you do sleep more, the damage that's done from sleep loss, it really can't be replaced. So staying ahead of sleep is really the only way to do it. Poor sleep is the oil light. That's the warning sign. So there's a lot of different warning issues that go on that could be causing sleep problems. And if you're getting to a point where you're not sleeping well and you've tried some simple things, the next few slides we'll go over is really where to start looking. Again, work with your doctor, work with us. We're happy to sit down with you and help you figure out these issues. We really work on embracing these 5 essentials when it comes to optimizing your sleep quality and health. So looking at making sure that you're getting the right nutrition, that you have the right mindset, and educating yourself on healthful sleep habits, that you're exercising properly and getting oxygen into your body. That's huge when it comes to sleep. Minimizing toxicity as well, getting adjusted and making sure that your spine and nervous system are functioning optimally. All of these things working together are going to help you optimize your healing in your body, make you thrive in your health. And as we're talking about sleep, all of these, again, are vitally important when it comes to helping you sleep well. We'll talk about the nervous system first. This is really where sleep comes from. You have these 2 different halves to your nervous system. So you have this parasympathetic nervous system, which is activated when we sleep. That is your resting, relaxing, digesting nervous system. You also have a sympathetic nervous system. That is your fight or flight. That's your awake, alert nervous system. So these 2 things have to work in combination in order for you to have good sleep-wake cycles, for you to be effective during the day, and for you to effectively heal overnight. Unfortunately, the vast majority of us, not all of us, there are some issues that involve people being hyper parasympathetic, but the vast majority of us have problems with being hyper sympathetic. Poor sleep is a direct relational issue in people who have sympathetic overdrive. That is, people who are stuck in a stressed state. We have a high heart rate, we have high blood pressure, our mind is overactive, we're constantly thinking about the next thing. We're sort of stuck in a loop sometimes when it comes to being focused overly on getting stuff done and achieving. And, I'm a victim of this too myself. We're irritable or moody. We can't slow down. We have poor digestive habits a lot of the time when we're in this sympathetic overdrive, because when you're in a hypersympathetic state, your body's not focused on healing. A sympathetic person, a person in that state, is focused on survival. And the problem is your body can't decipher. It has trouble deciphering between you being stressed running from a bear and you being stressed over a presentation that you have, or a life event, or your children. It's hard to differentiate the two. So if you're stuck in that sympathetic overdrive pattern, your body downregulates all these internal processes that are related towards healing, thinking, hey, we'll heal later. But if you're stuck in that state, your body never gets back into the healing state. Obviously, that can cause a huge issue. So here's a non-exhaustive list, 15 simple tips to start working on to make sure that you optimize your sleep healthily. So these are all tools that you can keep in your belt. And when I'm working with someone at first, these are what I call the low-hanging fruit items. Your body needs these. It's not that it doesn't, but a lot of times we don't think about the fact that all these things need to be in place in order for us to sleep well. So number one would be temperature. And I'm talking about room temperature specifically. You need your room to be cool. Your brain needs to drop in temperature about 2 to 3 degrees to initiate sleep. So when you're in a warm or a hot room, it can become more difficult to do that. So you're better off trying to sleep in a room that's colder rather than warmer. It's going to allow you to sleep a little bit better. People who sleep with less clothes on, don't make fun of them. It kind of makes sense. You want to make sure that you allow your body to calm down. And sometimes we have thick covers on and we're wearing clothing and we superheat ourselves. You ever feel that you start sweating in the middle of the night? Your body's not dropping in temperature enough, and it's going to make getting good, healthy sleep more challenging. So a way to help with this is to even raise your body temperature right before bed. So using sauna or red light or a warm bath shower, that can help because you heat your body up, and then your body can kind of jump on the bandwagon of when your body's kind of cooling back down. That can kind of help trigger that increase in melatonin production that relaxes you, that helps your body fall into a good deep sleep pattern. So if you're having trouble sleeping at night, using a warm bath or a shower or red light or sauna, something like that to increase your core temperature, then when it drops down, it'll help you sleep better. Number 3, you want to set the mood. Dim the lights before bedtime, keep the distractions to a minimum, shift your phone in the evenings to less blue light. So there's something on phones called night shift. You can get in there and change the brightness of it and the color hue so that you're not getting a lot of blue light. Slowing down, reading a book, making this a good routine. Those are all things that are really important. When you darken the room, it allows the photoreceptors in your eyes to sort of shut off. It triggers that whole melatonin production sleep process. There's a reason why Vegas has bright lights and keeps things active. Our brain can be tricked into thinking that it's not nighttime yet. And oftentimes, unwittingly, we do that to ourselves by keeping the lights bright in our room or in our bathroom, in our home, keeping our phones on super bright. And we're laying in bed on our phones and we're saying, gosh, why am I not tired? And it's like, well, you have your phone on the brightest setting and you're psychoactively stimulating yourself with getting hits of dopamine, at 9, 10, 11 o'clock at night. Well, no wonder you're not tired at night. You're literally actively shutting off this sleep mechanism. Limiting caffeine. So seriously, some of you who are on caffeine for a long time, I'm not going to tell you have to quit it all. There are some effects of caffeine that can be neuroprotective as well. But the idea here is you want to limit caffeine and not use it as a crutch. So, getting yourselves to a normal dosage of caffeine, somewhere between maybe a 100 milligram to 200 milligram at most, used throughout the day if you are in it for a long time. If you find yourself drinking 2, 3, 4 cups of coffee or doing a lot of caffeine, there's a warning sign there that you might be downregulating your sleep or trying to mask something. If you're doing caffeine as well, earlier in the day is going to be better. So rule of thumb, no coffee after noon. The half-life of coffee is quite long. The quarter of life of coffee is quite long as well. So if you drink coffee midday or into the evening, you're going to notice this. You're not going to be as tired at night. So the more you can keep that to a minimum, I think the better off you're going to be. Also, it's going to help kind of bring up some of these other issues that are going on, and you can deal with them directly because, again, caffeine can mask a lot of issues that are associated with poor sleep. Alcohol, limit it as well. Alcohol turns into sugar. It causes an insulin spike in your body, so it can cause you to wake up. Also, when you are using alcohol, it blocks REM sleep. So I wore a sleep tracker for about a month just to kind of test this theory for myself. Completely true that if you are processing alcohol, your body does not get into a restful state as well. The problem is that alcohol is actually a sedative. So we tend to think, oh, I have a drink or two at night and it helps me sleep better. You may sleep longer, but it's because you're not entering the deep sleep as early as you should. And so you wake up saying, oh my gosh, see, I slept 8 or 9 hours or whatever it is. The reality is it was not restful sleep. Get in your workout, especially in the morning. Getting up 150 minutes a week of moderate to intense exercise, scientists concluded can result in upwards of a 65% improvement in quality of sleep. Your body needs to move to heal well. And most physiologists agree that we should be moving anywhere from 8 to 10 hours a day on average, just low intensity exercise, getting up moving. A lot of us have jobs that require us to sit still for a long period of time. And that lack of physical motion, of cellular motion, leads to fatigue. Our lymphatic system doesn't work well to detoxify us. So moving more helps you sleep better. Absolutely. Sit still on a couch all day and watch how terrible your sleep is. So getting that moderate to high intensity exercise in throughout the week. Again, 150 minutes is 2.5 hours a week. So it's completely doable and it's vital for your health overall. Put the phone down, especially in the evening. Phones or laptops or tablets, they emit light that inhibit the melatonin production. So really, we talked about dimming the room. Your room should be pitch black. It should be extremely dark. You don't want any lights on that stop your body from producing the melatonin. Morning sunshine throughout the day, but especially in the morning. We talked about this a little bit before. The photoreceptors in your eyes are what trigger this roughly 16-hour wake cycle. So exposure to natural light in the morning can really help reset your internal biological clock. You can mimic this with internal bright lights to some extent, but truly speaking, nothing is as good as getting morning sun. So if you're getting up in the morning and you want to sit outside for a few minutes or get near a window and just really, look in towards the rising sun in the sky, it really helps to positively reset your body's biological clock. Sunlight also is essential for production of vitamin D. So as long as you're not chronically burning your skin, vitamin D is something that's essential for production of serotonin and melatonin, all the things that influence your sleep patterns. It also helps with immune system production. So you need to get good sunlight. So skip the late night snacks. A lot of times if you're eating right before bed, you're going to raise your blood sugar and then your body's working towards doing things more with like digesting, and it can slow down your body's production of melatonin to start sleeping. Also, some people have problems with being hungry before bed. So I think it's best to eat like a few hours before bed so that you're kind of waning off of digestion, but you're not starving where you're tossing and turning and wanting to go raid the cabinets. I think that the late night binge eating is dangerous. So I sort of stop eating around 7 or 8 when I get home from work. And I keep the carbohydrates typically low in the evening because I don't want a lot of energy. I don't want a lot of high blood sugar before I go to bed. I typically work out morning or midday, so I don't need all the other, junk in there anyways. And typically you'll sleep better. 3 common supplements I recommend for people who have sleep issues. So number 1 would be a sleep and mood formula. Using a compound that combines either a low dose of melatonin or something known as 5-hydroxytryptophan can help your body regulate its own sleep-wake cycle. So our sleep and mood formula combines those two together, 5-hydroxytryptophan, which helps increase your body's production of dopamine and serotonin, along with melatonin to help you get to sleep at night. This would be a nighttime formula. In some people who don't have a problem with melatonin production or they're sensitive to melatonin, we use direct 5-HTP. So we have another specialty supplement that we can order that is only 5-HTP that can help your body to boost its own production of dopamine and serotonin so that you can better regulate your sleep and wake cycles. Another supplementation piece that I love when it comes to getting better sleep is adrenal balance. A lot of us have dysregulated cortisol and hormones, and a lot of times this starts from bad sleep. And so once our sleep is bad, it's hard to fix it. And using adrenal balance helps our adrenal glands produce the right amounts of hormones to help regulate our sleep and wake cycles. Adrenal balance is a great formula for that. And all of our supplements now are created in US labs, and they're all sustainably sourced organic ingredients, which I love. So you know you're not getting synthetic junk in there. You're getting really, truly high quality nutrients that help your body heal. The last would be magnesium. Magnesium is important for a whole host of processes, but it does help to relax our body. And so commonly I'll recommend magnesium for people who are working out intensively, who have lots of high stress, or who struggle with sleep. It really helps to put the body into a healing, relaxed state, helps to relax muscles, helps to calm our body down, and really can help to improve the quality of our digestion and of our sleep patternings. So if you're having issues with sleep, this is your sleep stack I'd recommend starting with. Again, if you have any more questions, you can email our office, or you can set up a consultation with myself or one of the doctors in our clinic so that we can really help to get more in-depth answers for you, whether that's a more in-depth nutrition protocol, supplementation protocol, or doing lab testing to get to the underlying cause as to why you're not sleeping well and getting the rest that you deserve. Number 11, consistent timing. So if you find yourself getting the Monday blues or the Tuesday blues, you want to keep your sleep cycles very regimented. Oftentimes we tend to think that we can just do whatever we want to on the weekends and make up for it during the week, or vice versa. We want to catch up on our sleep on the weekends. The reality is the more that you keep your life to a consistent cycle, that's not just with sleep, it's with everything, the better off you're going to be. Diet should be consistent. Sleep-wake cycle should be consistent. Your body's going to respond to yourself being on a better, more regular schedule. 12, make your bed. And while you're at it, declutter your home. The human brain gets occupied a lot with clutter and with mess. So a reason to make your bed during the day is because it's going to de-stress you. Research shows that people who make their bed and keep a clean room on average get 19% better sleep. You may have noticed that when you're in a hotel room, it's easier to sleep. A clean room and a made bed make a huge difference. So how are you going to sleep better? Declutter your home, get rid of the distractions, have a clean bed. It makes it so much easier to get to and stay asleep. Number 13, get adjusted regularly. Keeping your nervous system in a balanced state with chiropractic care is a great tool that you can use to help to keep your body's nervous system regulated well. We have this fight or flight system in our body that is a responder to stress, and it increases our sympathetic nervous system. We know that getting adjusted helps to activate the parasympathetic part, or the resting, digesting part of your nervous system. So that's why whenever we adjust people, we'll commonly hear them talk about over the first few weeks to few months, hey, I've noticed my blood pressure is better. I've noticed that my digestive habits are better. I'm sleeping better. I'm more relaxed in the evenings. These are all components of a better functioning parasympathetic nervous system. So you want these two parts, sympathetic and parasympathetic, to work in hand with one another. You don't want one to be more dominant. Again, we generally tend to dominate towards the sympathetic nervous system. So getting adjusted, reducing your pain, improving your posture, helping your nervous system be able to heal your body. That's why we have you guys use chiropractic as a tool. So if you're getting adjusted in the corrective portion of your care, our aim is to balance everything, get your posture aligned well, get rid of the underlying chronic issues you have. And then for lifetime maintenance care, it's about keeping you ahead of life. Research shows that people who get adjusted and stay well adjusted, they spend less on healthcare costs. They take less medications on average. They have less surgeries on average. They're hospitalized less often with emergencies. Nervous system health is vital to long-term health. And chiropractic is one of the best tools we have to incorporate into a lifestyle to help keep your body balanced, prevent degeneration, and really just make sure that your body's functioning at its optimal state. Number 14 is breathing. And of course you say it, I couldn't be here if I didn't breathe. But a lot of us have forgotten how to breathe properly. So great breaths come through the nose, not through the mouth. And all too often we tend to breathe more shallowly. And so a big component of getting good breath in is to take what is known as a double inhale followed by a long exhale. So it's 1, 2 inhales and a long exhale. Shallow breathing doesn't allow our lungs to expand. It leads to a lack of oxygen. That can be a stressor for us. So again, think deep breathing, think breathing through the nose, think big inhales, another big inhale, deep exhales as well. It's going to help your body regulate itself a lot better and get that needed oxygen into the body, into the muscles, so you can stay healthy. Last thing, sleep position. Choose the right one, whether you're a soldier, a starfish, a log, a yearner, fetus, free faller. There are definitely better ways to sleep than others. And so what I'll tell you guys to do is this. I'm going to go backwards. Use your sleep rolls. Use these. These are designed to help keep the curvatures of your spine in a great place so that the nerves are relaxed so that your body can calm down. So the big roll under your neck, the small roll under your lower back helps to retain those healthy arches in your spine, and it really should help your body calm down to sleep well. If you're in the beginning of care, sometimes it can be hard to use these sleep rolls as commonly because you have misalignments in your spine, and we're working on correcting those. But as you get comfortable with sleeping on them for longer and longer, it's really the best way to sleep overall. The second best way to sleep overall, if you're not using your sleep rolls, would be using the soldier technique or sleeping on your back. It keeps your spine the most neutral, keeps the muscles of your body the most neutral as well, isn't stretching your body. And so typically speaking, back sleepers sleep the best. Second best would be on your side if you have a nice thick pillow. The worst way to sleep would be on your stomach. It causes you to turn your neck. It can close off your trachea, making it harder to breathe, which can lead to apnea or waking you up during your sleep, so you're not getting restful sleep. And it can really have a negative effect on your chest. So it can cause compression in your chest. It's better to sleep on your back or on your side with the home rolls, ideally speaking, for as long as possible. So your action steps after this is to start working on implementing these things into your lifestyle on a daily basis. Nothing that happens for our health typically happens without intention. And so if you feel overwhelmed, please sit down and talk with us. We want to help you integrate as many of these healthy action steps into your life as possible. If you're a guest, your first step to better sleep is scheduling an appointment in our office. Get your spine evaluated, get your nervous system evaluated, and let us work with you to help optimize your sleep and optimize your health and healing. And if you're a patient and you know someone who needs help, just share this video with them and reach out. We're all in this together, and the whole goal of this office is to help this community be in better health. We want to raise our kids and ourselves to be healthier than the environments that we grew up in. And so the more we raise this collective state of helping each other get better, the healthier we're going to be overall. I'll close with this slide as a recap. 30 days to amazing sleep. Follow these 10 steps. Unplug your phone 30 minutes before bed. Black out your sleep sanctuary. Wake up at the same time. Lower the temperature in your home and bedroom. Get your bed made. Limit caffeine intake. No sugar or alcohol within 2 hours of bedtime. Exercise daily. Take adrenal balance, sleep, mood, multivitamins to help your body heal and get adjusted. Take care to align your spine. We've got some great upcoming events in our office, so you can check these out if you're in the office at the front desk or by calling our office. If you want to go online, bealignhealth.com is a great place to go to see all of our upcoming events. And then make sure you follow us on social media, on Facebook, on Instagram, on YouTube. We're constantly putting up new videos. In the world that we live in, that is constantly more stress, more go. Taking time to build your health and attend these virtual or live in-person workshops is really going to be a key factor in being healthy long-term. Hope you guys enjoy the workshop. Have a great day. We'll see y'all soon.